Hello, everyone, and welcome back to Resilient Health Radio. I'm your host, Dr. Darin Ingels. And my guest today is a friend and colleague and fellow naturopathic physician, Dr. Christine Schaffner. Dr. Schaffner and we've known each other for a while now, and I really appreciate Dr. Schaffner because she and I have very similar practices. We treat a lot of Lyme, we treat a lot of, toxicity, mold. So our practices are very similar. And I also appreciate the fact that she, again, is really one of these root cause medicine doctors that's really interested in finding out the source of what's getting you sick, keeping you sick, and helping you get better. So, Dr. Christine, thank you so much for joining me today.
Oh, thank you so much. It's always so fun to connect with you.
Yeah, so today I want to talk a little bit about the lymph system. You and I do so much work in our practices about detoxification and helping people, get rid of all the junk that we're exposed to on a day-to-day basis. But I think we talk so much about like the liver and sometimes the skin, but we've got this deep network in our body called the lymphatic system that often I think gets overlooked in conventional medicine. So maybe just talk a little bit about the lymphatic system. What is it? What does it do? And why is it important for people?
Yeah, absolutely. And this is one of my favorite topics because I think it's our shared passion and getting to the root cause and really help people get a lot of the things that are making them ill out of their body. And I feel like the lymphatic system is this system that's often overlooked, and it's really the connection in our patients because of its ability to clear waste and also help our immune systems have an appropriate response to a lot of the chronic pathogens that we treat people for. So it's this kind of intersection of toxicity and our immune system, and it's really important and overlooked. And so just a wide angle view of the lymphatic system, as you mentioned, it's this body-wide network, right? So we have these lymphatic capillaries and vessels and nodes and organs. And as I mentioned, its job is to remove waste as well as help our body recognize and clear quote foreign invaders. And sometimes that becomes compromise that ability, especially when people have chronic illnesses. And I'll just kind of share too, like how it's highly interconnected to the circulatory system. So we know in anatomy books, if you ever, Google an anatomy book, often, the arterial system is red, the venous system is blue, and the lymphatic system is often green. And so that's not quite how the body works. It's not that compartmentalized, but it's good a visual, right? And so our heart, basically oxygen rich blood leaves our heart and it travels through these red arteries, through our body. And then when we get down into the tissue space, these arteries get smaller and smaller and become capillaries. And in the capillary space, this is, where a lot of the action of our physiology happens, right? How well can we get oxygen rich blood to our tissues and remove waste? And what happens in that capillary space is that some of the fluid leaves the capillaries and some of it returns, but some of it that leaves becomes what we call interstitial fluid, or it's the pre-lymph. And what this is it's the body's ability to deliver oxygen and nutrition to what we call the extracellular matrix, and that's a big part of where we're aligned. I think that's a lot of where our therapies target, right? This extracellular matrix, and what that is it's the space in between our cells, and I'll come back to that in a moment. But what essentially happens then, blood, some of the fluid returns to the blue now, capillaries that turn into blue veins and return to the heart. And then, again, this fluid that is in this tissue space is called interstitial or pre-lymph. It's the beginning of the lymphatics. And the extracellular matrix, as I mentioned, many of our mentors and people who are kind of the fathers of naturopathic medicine talk a lot about terrain medicine, or how disease starts in what we call the matrix. And this is why, is because we're only as healthy as this space is able to be able to deliver nutrition, oxygen to ourselves and remove waste. And then when we're thinking about the onslaught of what we're all exposed to on a regular basis with the environmental toxicants and the chronic infections that many of us become exposed to and aren't able to clear, this is where this is the space where those things tend to linger. And if you don't have good mechanisms to really, get the fluid moving, get the immune system engaged, what can happen is things like glyphosate can affect our collagen, and heavy metals can bind to different proteoglycans. And then, all this inflammation can deplete electrons. And then Lyme lives, connective tissue, and viruses hang out here, and mast cells, get triggered by different factors and can release histamine in the space. And then what happens is that the space becomes degraded, chronic inflammation starts to hang out in the space, and then cells have a harder time communicating. And then that can perpetuate what we call the cell danger response as well. And so, one really, this is complicated but simple in a lot of ways, is that the more we make sure that those lymphatic capillaries that line that space are able to take that fluid and keep it moving and basically get supported through what we call the lymphatic capillaries that become what we call vessels, which then maybe encounter nodes, which where the immune system really engages with what is in the fluid. And then this fluid gets returned to circulation through really our thoracic duct and our right lymphatic duct. And what's interesting about this system is that it's a one-way valve system that is really reliant on our movement in the body. So if we're having these things that I've just talked about, and we're sedentary, or we just can't keep up with really what we're exposed to, then there's this buildup and stagnation in the space. And that's when a lot of our Lyme patients, right, one of the key hallmark signs is we feel the lymph nodes in the neck, and we can feel a lot of lymphatic inflammation. So that's a key sign to know that you have lymphatic stagnation there. I think a big overlooked symptom for lymphatic congestion too is a lot of the lymphatic system in the gut, right? So within the intestines and then behind the intestines, in the mesentery, there can be buildup of lymphatic fluid, and there is this interconnection. So if there's stagnation in one area in the lymphatic system, that can create, a whole host of, effects in distant tissues too. So like if you're having neuropathy or blood flow issues in your lower extremities, we want to like look upstream and make sure that the lymph has somewhere to go so that things are constantly flowing. So that's a really long-winded answer about the lymphatic system, but I just wanted to share like that overview, and I'm happy to dive in wherever you'd like me to go.
Yeah, I think we've all had the experience of having swollen lymph nodes, swollen glands. We get strep throat, we get some kind of infection, and those nodes are swelling is really a marker that your immune system's been activated. It's trying to help in that case fight infection. But sometimes we'll see chronic swollen glands that really don't have anything to do with infection, and that can be due to really any kind of chronic toxicity. Again, I think it's just a physical sign that your body's trying to clear something out of the system, and really its defense. And I like the fact that, as you said, that the lymph system, doesn't have kind of a pulse behind it. I mean, your blood moves because your heart is a pump. It's
Yeah.
pumping the blood through at a certain, rate and rhythm, but your lymph system doesn't have that. So it really is dependent on our movement
Yeah.
to keep that fluid moving in one direction. And of course,
Yeah.
for a lot of our Lyme patients that aren't as physically active, or people that might have other chronic conditions where they're more sedentary, getting swollen legs, swollen hands, often that's just a sign that your lymph is kind of backing up. It's not clearing out the way it's supposed to, and that's what's causing what we call edema.
Mhm, mhm. Yeah, and I think, with our Lyme patients, I'm happy to walk you through too. There's like some really key areas, that I find, our Lyme and our chronic illness patients, get, stuck. And this is kind of maybe like a checklist for people to think about when you're looking at their lymphatic system. And even to take a step further to behind even that, I think you do this as well. Darin is like looking at scar history, right? So scars in bioregulatory medicine can be what we call interference fields. And what that means is that scars can become disruptions in the fascial system and the lymphatics. And even if, from the acupuncture meridian lens, it can potentially block meridian flow in the area. And so, scar tissue can be it can definitely block the lymphatic system. So if you're doing everything and your lymph isn't moving, I would take like a scar checklist. I use neural therapy. There are other techniques and tools to help break down scar tissue and open up, basically circulation and flow in those tissues. We often find too that scars can hold emotional memory, and it's just kind of a clinical anecdote. And a lot of people try to make sense of why and how that happens. But we can hold, emotions in our tissues. And so if people have had an surgical trauma or an injury, sometimes part of that blocked flow in that area can be emotional stagnation as well. So different therapies can help release and let movement, let release of those traumas and emotions out of the tissues. So just that's an aside, just scar history. I take a scar history for every patient, and then with the Lyme patients and chronically ill patients, I find there can be a lot of stagnation. As we mentioned, we talked about the neck and, the tissue in the back of the throat called the tonsils, right? So there's, not the two tonsils, there's five. And people might have had history of strep or Epstein-Barr, or they might have toxicity in their mouth that continues to drain into their tonsils. But this is really key immune regulation tissue, I find. And there can often be chronic inflammation or chronic infection in this tissue that can continue to basically create stagnation and poison the lymphatic system. And it's at the base of the brain and the top of the gut. So it's really important for our patients. And I could talk for 2 hours about that and tissue alone. And
Yeah.
get my patients teach me, like, a lot of them have like chronic disruptions in that tissue. So we do different throat sprays and gargles and ozone and things to help just really heal that area. And then looking at that relationship too. A lot of our patients have neurological issues, right? So we want to really support the body's innate ability to self-cleanse the brain, and that happens at sleep. So when we sleep, and there's different stages of sleep, so we're always trying to get optimum levels of deep sleep and REM sleep. And during those times, we actually have more what we call lymphatic activity, and that's going to be the lymph system in the brain, right? So that's going to be the glial dependent lymphatic system that our brain naturally gets rid of these environmental toxicants and helps to remove pathogens as well when we sleep. And so that for that to drain well at night, we need to have a good exit route, and that's why we look at the tonsils and the cervical lymph nodes. And then the gut I mentioned, right? So the gut can be a huge area where people have a lot of disturbances. And so there's the lymphatics in the gut, right? The lacteals and the Peyer's patches, and all of these things that if you have a lot of chronic inflammation, they might not be absorbing and regulating as well. And then I mentioned too something that I was taught from one of our teachers is that there is lymph buildup sometimes between the intestines and the abdominal wall, and there can be fluid in that area and in the connective tissue there. And that can be, when that is not draining, there's inflammation in the gut and then behind the gut, and then that can affect the whole system. So sometimes we have lymphatic therapies that move the lymph in the abdomen first. I think that's why castor oil works so well. I mean, I think there's
Right.
many reasons why castor oil works well. We've used that for many, many decades in naturopathic medicine. And I think part of why it works well is its ability to move lymph, and especially when we apply it over the liver and the abdomen. And then I mentioned too, the a lot of our patients, especially who have Bartonella or just different issues, can have a lot of pain or neuropathy or edema in their lower legs. And when that's happening, we think about everything, but we also think about there's lymphatics in the pelvic floor and in the kind of the groin area. And if those aren't draining well, or if there's a lot of inflammation there, you think that upstream, like, then we have to open that up in order to get the legs to drain. So that's again just highlighting some areas that I'm always looking at, with my patients. And then I do think, Darren, pain, a lot of times, our patients are in chronic pain, and there's a lymphatic stagnation component to pain. And the more that we can get, fluids moving and waste out of that tissue and oxygen into that tissue, the body can clear the underlying pathologies and triggers that are triggering the inflammation that's, chronic pain. So that's why the lymphatic system is so important.
Yeah, and I think it's important for people tuning in that, any kind of swollen glands. I mean, we talk a lot about the neck because this is very common, but if it's in your armpit, if it's in
Yep.
your groin area, behind your head, you've got these lymph nodes found out throughout your body. And of course, you have a whole chain of them kind of deep in your chest and your belly that you're not likely to feel. But those superficial ones that tend to come up on the neck, the armpit, and the groin, those are probably the ones you're more likely to notice. And if they've been swollen for a while, if you notice lumps and bumps down there, you definitely want to get off to your doctor, have them checked out. Uh, Most of the time, fortunately, it's relative to some level of infection or potentially toxicity, but once in a while, it can be related to some element of cancer. So Again,
Yeah.
it's a good idea if it's been there for a bit to get it checked out with your doctor and just make sure everything's okay.
Yeah, absolutely. And I forgot to mention too, Darren, for women, breast health is really tied into lymphatic health. So we have, groups of lymph nodes in our armpits. So whether you're a male or female, of course, those need to be, draining. But for women, if you have a lot of different, breast symptoms from either fluid retention at different times in your menstrual cycle to fibrocystic breast, to there can be these benign tumors called fibroadenomas. So sometimes I'll have women actually apply different topicals or castor oil to their breasts to help to get the lymphatics draining the breast tissue as well.
Yeah, I don't want to go too sideways on this, but I think this is important because one of the things I see in my practice,
Mhm.
women in bras,
Yes.
it seems to me that an ill-fitted bras with underwires really choke off a lot of the lymphatic flow. So, what are
Yeah.
your recommendations to women with their bra?
Yeah. Yeah, no, it's a really important topic. And I actually have a friend who owns a lingerie store who I've, found different non-underwire bras that are really quite comfortable. And women, I think, need to admit to themselves that underwire bras are not comfortable. And there is some sense of, that the lymphatic stagnation can happen over, time. And so I'm really glad that you brought that up. And so a lot of my female patients, I just, give them, different options or resources, and there's a lot out there to have just and especially in the athleisure wear world, there's a lot of just even built-in bras and different
Right.
shirts and things. But that I think is really overlooked. And when you think about the brain draining, if you have lymphatic stagnation in your breasts, if you're a woman, and even men, I mean, men have lymphatics in their breast tissue as well. And then if you have stagnation there, it's going to be harder for the thoracic duct and the right lymphatic duct to receive lymph. And so you can actually have lymphatic stagnation in your head if your breasts aren't draining. So I feel like it's all interrelated and it's really, really important. So I have people wear non-underwire bras. I mentioned castor oil can be very helpful. There are other products that I can use to, open up the lymphatic system in the armpit and the lymph around the breast to help drain breast tissue. I also look at the dental piece too, Darren. If people have a lot of basically toxicity in the mouth, that can drain into the breast and that can create problems as well.
Great. Great. Yeah, no, I think it's really important because again, I just see and hear from so many women about the comfort of their bra and know that this is a potential long-term problem because I think most women wear a bra mostly every day.
Yeah.
Over time, again, particularly if it's too tight, has an underwire, I
Yeah.
can just see that this is going to lead to some element of lymph stagnation. And of course, if we're trying to get your overall health improved, this is just, I think, a fairly easy thing to fix with just an appropriate bra fitting. So, yeah.
Yeah, yeah. And just one more point to that, Darren, is that I'm sure you've seen a fair amount of patients who either, have breast implants or just decide to get their breast implants, removed, which we're all a fan of. But there can be scars, right, from
Right.
different surgeries. And I often will treat women's breast explant scars and hopefully, I mean, even implant scars, hopefully they're getting their implants out, but even those scars alone can create a lot of stagnation in the whole lymphatic system.
Yeah, you talked a little bit earlier about neural therapy, and for those who aren't familiar with it, it basically the process is going in and injecting a scar with usually, I think it's a little bit of dextrose, right? Is that what you
But
use?
yeah, I use propane.
Propane. Okay.
Yeah, propane. Mhm.
And it's really to kind of help, break up a little bit of that scar tissue, but I think it's more than that. And again, I don't do this in my practice, but I'm not an expert, so maybe you can say a little bit more about it.
Yeah, yeah, yeah. I'm happy to.
Kind of
It's
understand it. Yeah.
Yeah, it's really comes out of Germany. These two brothers found this, property of procaine and found when you basically would inject either scars or toxic ganglia, there could be a reversal of symptoms. And so they found this, really powerful effect that this injection technique had. And so in modern day, how we use it, I most often use it with scar therapy. And so I use the substance called procaine. It's a local anesthetic. It's compounded. We use it 1% preservative free, and procaine has a property that it can really help to break down scar tissue. So the actual tissue of the scar can help to soften. People sometimes like the cosmetic effect if scars haven't quite healed. If there's redness or kind of lingering issues from the scar, that it cosmetically can look, better over time with the injection. So it helps to soften the scar tissue, and then it helps to bring circulation, helps the lymph move in the scar tissue. It has an effect on the cell membrane potential too, just with the anesthetic property. So there's this theory in neurotherapy that cells in a scar can have a lower resting membrane potential than healthy cells. So then this almost helps to increase the electrical voltage of those cells to make them less disruptive to the overall communication in that tissue in the nervous system. So we do see that there's kind of an electrical kind of autonomic, effect, when people get their scars injected. And not only scars, I don't do this in my office, but they're deeper ganglion injections. So these kind of fuse boxes of, our nervous system that can bioaccumulate neurotoxins and infections, that it's kind of almost the fleshing out of those from deeper ganglion can help to reset the nervous system. And then there's another way that we can use neurotherapy. It's called segmental therapy. And segmental therapy, I call like acupuncture on steroids. It just helps to bring, a lot of lymph drainage, a lot of circulation to tissues. So, like for instance, the liver will do very superficial injections of these wheels over the liver, and it works with something called the visceral cutaneous reflex. So, this idea if we treat the skin, we can actually affect deeper communication through the nerves that regulate the capillaries around different organs like the liver. So it's a really powerful way to kind of just bring more energy, to an organ. So in the Lyme world, I use a lot of liver neural therapy. We'll do the kidneys. Well, we can do a small intestine pattern, a lymph pattern, the sinus pattern. There's one called the crown when we anyone who's had a head injury or any like cognitive issues, we'll do that one. We can inject tonsils or tonsil scars as well. And then, as I mentioned, they're the deeper ganglion injections as well.
Yeah, I said I don't do it as a practitioner. I have had it done to myself though, and it's
Yeah.
funny because I think when you see someone coming at your scar with a needle, you're anticipating it's really going to hurt. But when you have a scar, it pretty much kills all your nerve endings, so it actually doesn't
Yeah.
hurt. You kind
Yeah.
of feel anything, so it's a
Yeah.
really benign treatment. But again, clinically, I think it's another great therapy that really
Yeah.
helps, and it's something again that gets overlooked in medicine that we don't think about the effect of having these scars, whether it's from an injury or surgery. Depending on the location, it can kind of interfere with the underlying tissue and certainly our sort of bioenergetic pathways that are found all throughout our body.
Yeah, absolutely.
So, what are some other things that people can do to help improve their lymph flow? We talked a little bit about movement, exercise, but what are some other things you recommend for folks to help them improve their lymph?
Yeah, absolutely. So often, our patients, we recommend things at home, and then depending on if you're struggling a lot out there, I would also consider working with a practitioner to really guide and support getting your lymphatic system moving. It will just help you to, make more momentum, I believe, in your health. And so, having a skilled lymphatic drainage practitioner, they're often massage therapists who've had some type of lymph training. There's different equipment out there in the community. My friend Kelly Kennedy has an equipment that she shared with me that I have in my office that's called the Flow Presso, and it uses compression, infrared, and nano vibrational technology. So it's deeply relaxing and really can move the lymph. There's other techniques and tools out there like the Lymph Star and ST8, and all of these different equipments. But that can be helpful. Home tools can be vibration plates, rebounders, dry skin brushing. In the aesthetic world, there are these stones called gua shas that you can use on the face and the body that really help to move lymph. And when you're moving lymph, you just want to always open up upstream before you go downstream. So I always have people open up, basically the thoracic duct and the right lymphatic duct first, and then let's say you're gonna, drain, let's say your lower arm, you would want to open up your armpit, open up the upper arm, and then go to the lower arm. So this you have a pathway where the lymph can continue to drain and move. So that can be very helpful. And then I use different, herbals. There's a lot of different herbal blends, combination of herbs that you can use internally. So from even, cleavers and nettles and red root and, different, herbs that we use every day to help, move lymph. Proteolytic enzymes can be helpful, as well. And then I'll use a lot of topicals from essential oils to, we created a product with my dear friend, Dr. Marco Ruggiero, and he's brilliant. He's done a lot of research on, the immune system and also the microbiome. And he developed a product that we've used. We call it Lymph, and it's a proprietary blend of probiotics. So the probiotics themselves actually make a peptide called macrophage activating factors. So there's a immune effect from what the microbes are producing, and that's in a blend with what we call microbial derived chondroitin sulfate. And chondroitin sulfate is what makes up a lot of, I think I mentioned proteoglycans, that word, in when I was describing the extracellular matrix. And we have chondroitin sulfate basically in our extracellular matrix, and that can become, depleted or, compromised when there's chronic inflammation. So I see it as like twofold, that the chondroitin sulfate helps to drive and deliver the peptide into the extracellular matrix and into the lymphatics. And then the chondroitin sulfate itself is part of the why it works, I believe. So the chondroitin sulfate can serve as what we call an electron reservoir, so it can hold electrons in the protein to help with inflammation. There's a whole world about exclusion zone water, and I feel like very much a student, but I try to share information and strategies for my patients to increase exclusion zones in their body and the water system in the body. That's going to help with detoxification and lymphatic drainage and cell voltage and energy and all of these good things. So the sulfate itself can help in that process as well. So it's those factors that make the cream unique, and we're just using the principles of the skin to drive this ingredient into we have the skin, we have the dermis. Underneath there, we have the interstitium, which is another kind of newly discovered organ, which is the fluid between the connective tissue that helps to deliver things deeper into the lymphatics. And that's, I think, of why we can use the skin in the topical transdermal route for, even conventional medicine knows that we can use patches and creams to deliver, hormones or different medications. And so I love using topicals for the lymph for this reason.
So, how are you using this particular product?
Yeah, so I, instruct my patients first to use this at night at bedtime because I mentioned also about the lymphatic system. So a lot of my patients have neurological symptoms, and we want to really make sure that their brain is, cleansing at night and supported at night. And so to help make sure that the lymph system has somewhere to exit, we put it on the neck to help decrease any potential stagnation in the cervical lymph nodes in the neck so that the lymphatic system can drain at night. So I start there, and then everyone's going to have a different experience. I've had all sorts of different anecdotes over the years. For pain and inflammation, people have found a lot of relief. Scars, so if you can't get to a neural therapist, you can use this over scars. I've had some people with restless leg. After dental surgery, it can be very helpful. Also if you technically have edema, anywhere in poor circulation, that's going to be helpful as well. So, I instruct again, let's start at the neck, use it at bedtime, and then people typically get creative and have all sorts of anecdotes that they share with the cream. But it really it's powerful, and I know you and I both create products, and we really try to create things that are going to move the needle in people's protocols.
Right. Well, we're going to share the link for the product with everyone in the show notes. So definitely check it out. So, really, for anybody listening, if you've been dealing with, chronic illness, especially chronic swollen glands, you definitely want to work on improving your lymph system. I'm sure, yourself and your healthcare provider are working so much on your diet and your sleep and, everything else we do in, whole body medicine. But again, this is the one piece I think a lot of times it gets overlooked. And yet it's such a critical part of getting well, because I think most people with chronic illness have some element of toxicity, and part of the reason they're chronically ill is that they just don't detoxify well. So there's so many things that are simple, easy to do. Dr. Schaffner, I really appreciate you sharing all these tips with everyone today, and I hope you guys take heed to this because there's just so much you can do to help improve your lymph flow.
Oh, thank you so much for having me. It's always so much fun to connect with you.
Thanks, Christine.
Thanks.